Hi, I'm Dr. Egan from Now Hear This, and today I'm going to talk to you about the truth about invisible hearing aids and the things that people don't tell you. So we're going to go through a bunch of common questions patients here have about hearing aids, the invisible kind. And the first one that is very common is, are hearing aids actually invisible? Invisible hearing aids come in different shapes and sizes. Here is one for example. This one is a stock fit because I don't have hearing loss, so I don't have custom invisible hearing aids. But to give you an idea of how discreet they can be, I'm going to put it in. Just takes a little bit of twisting around in the ear canal. And as you can see, you can't see anything at all from the front, and even from the side, there's really not much. There's a tiny little pull string right there peeking out, but they're very discreet, which is why they are a very popular hearing aid product and why so many people have questions about them. Another common question folks have when they come in is, do invisible hearing aids sound as good as bigger hearing aids? And that's a great question. Hearing aids and their different shapes and sizes do impact the sound quality, but this is really dependent on the type of hearing loss you have. So if you are someone who has a lot of hearing loss, like say it's a severe hearing loss in the mid, low, and high pitches across the board, then an invisible in the ear hearing aid or a behind the ear bigger hearing aid, they're gonna both do the same thing because you really need to plug up your ear to trap all the sound in that your brain needs to hear. However, if you have a more slight or mild hearing loss, especially if it's in the low pitches, you might not like an invisible hearing aid as much because you want to hear the good low pitches naturally, and having something go in your ear like this and plug it up, some people are able to get used to that sound quality and some people can't. And that's, another really important reason that you should find a clinic that works with all 7 manufacturers, because there are so many different kinds of hearing aids, be it in the ear, invisible or otherwise, and working with an audiologist who will try all the different ones with you as you figure out what works best for you is really important. Another common question, what are the downsides that no one talks about in regards to invisible in the ear hearing aids? And I think that really comes down to care and maintenance. When something is living and breathing, this tiny electrical device in your ear canal, there's more moisture building up on it, especially down here in the South. There's more wax building up on it throughout the year. And it's a fully encased device, so there is less we can troubleshoot in the clinic and less parts we can replace in clinic. So a downside would be sometimes invisible in the ear hearing aids need to get sent out to the manufacturer for repair more. But it totally depends on the person. If you don't build up a lot of wax, if you're not in the heat or humidity a lot, that might not be an issue for you at all. Another common question people have is, how comfortable are invisible in the ear hearing aids for all day wear? Great question. I totally see how people might think it wouldn't be comfortable, but they really are. This one is a stock piece. It's not custom fit, so it's a little bit more iffy. If someone has a small or curvy ear canal, they might not find it comfortable, but all 7 manufacturers do have a form that is custom made. So the audiologist would do an ear mold impression of your ear, send it to the manufacturer so that it is a comfortable fit. And all the manufacturers have really good remake periods. So even if a piece is too bulky or it doesn't fit right the right way, you have time to try it out, wear it all the time, get used to it, and they can always remake it for you. Another common question folks have about invisible in the ear hearing aids is, how hard are they to take in and out? And as you'll start to see as a theme, it really depends on the person, just like the sound quality. It depends on the hearing loss. All these things are so custom to the individual, and how hard it is to take it in or out comes down to your dexterity. People who are used to taking in and out their earrings definitely have an easier time taking in or out invisible in the ear hearing aids. And people who have numbness or tingling in their fingers or arthritic joints and things like that, they're going to have more difficulty. So again, it's really important to find an audiologist who will take the time to get to know you, your specific needs, strengths, weaknesses, and find the right device for you to use long term. Another common question folks have is, do hearing aids that are invisible in the ear work in noisy places? Great question. That's the most common place people with hearing loss struggle to hear. I'd want to know the same thing. And yes, they can do a great job in noise. Again, it comes a little bit down to the configuration of the hearing loss because of how plugged up your ear would be. And it also comes down to the specific manufacturer and which brands are best at suppressing background noises and figuring out what the speech sounds are that you want to hear. So it's important that you work with someone who has all the different manufacturers so you can test drive those as needed. And then the last question I have is, what mistakes do people make when choosing invisible hearing aids? And I think a lot of folks immediately go to the invisible hearing aid because they see lots of ads for it online. And that is because those ads are effective. Someone who has hearing loss might not want hearing aids, but it's a lot easier to say yes to a tiny little thing than something that has some extra parts and pieces and sits behind the ear. But the truth is, it's not always the right fit for someone. And so if someone comes in saying, I want an invisible hearing aid, and the audiologist doesn't do a thorough listening needs assessment to figure out what are all the other factors we need to consider, they might end up with one that is not the right fit. They might have really curvy, tiny ear canals that make an invisible in the ear hearing aid uncomfortable. They might really value certain Bluetooth features that aren't available in an invisible hearing aid because it's so small. And so I think the mistake is when people get really hooked on just one device versus being open-minded and open to learning about all the different kinds of technology in hearing aids, because things are always changing in the hearing aid industry. I hope you learned something about invisible in-the-ear hearing aids. Question, comments, or concerns, feel free to schedule a consult at our clinic, and our website is nowhearthisclinic.com. I hope you learned something. Have a wonderful rest of your day. Bye-bye.